What's up guys, welcome back to my channel. In today's video, I'm going to be going over exactly what to expect whenever you first start dental hygiene school. Now obviously everyone's experience can be different, but I'm personally just going to be going over what I needed to prepare for and what was expected of me when I first started dental hygiene school. If this is your first time seeing me, hello, my name is Rachel, and if dental hygiene is something that you are super interested in, then make sure you hit that subscribe button because I post a ton of content related to this subject. So going into dental hygiene school, they give you this beautiful handbook that you have to go over, and it tells you exactly what to expect, what the procedures are, everything that you need to know going into the program. And obviously you are working in a very professional setting. You are working with patients, you are working with other students, and at all times you are expected to dress and act professionally. Now with that being said, of course you are also going to be working closely with patients. So these are either people who you know that you bring in yourself, or random people from the street, people who are already established patients of the clinic. It doesn't matter. You have to make sure that you are always keeping everything confidential, because any information that you get on any certain patient, you cannot relay that information to anyone else. Now within the clinic, within the students, the instructors, you're learning, you have to discuss cases with them, but outside of school, that cannot be discussed. So say you had a patient come in and while you're talking to them, you realize that it's one of your friend's cousins. You cannot just go to your friend and say, hey, I saw your cousin, I was cleaning his teeth at the clinic, I noticed that he had XYZ. You cannot say that unless you specifically ask that patient if you have their permission to relay information to another person. You are not allowed to break that confidentiality. You are learning people's medical histories, dental history, you are knowing their dental charting, you're knowing exactly what is in their mouth, and that is information that cannot be shared with any other person. HIPAA compliance is something that is going to be stressed to you a lot, for very, very good reasons. Now on top of that, there is a very strict dress code that we always had to follow. All of our designated clinic attire, so our scrubs, our lab coats, everything had to be on at all times whenever we are doing anything that has to do with clinic. We're not able to just pull them out of a pile of clothes and throw them on. They always had to be freshly cleaned and ironed. We can't be going in there with a bunch of wrinkles, or else they will deduct points for our appearance. And with that being said, we have to make sure there's no holes, there's no pen marks, there's no scuffs anywhere. Everything is very nice, neat, and clean. And in case of an emergency, we were always suggested to have an extra full set of clothes to wear for clinic, just in case we were to get them dirty. We had something that we were able to immediately change into. We were not allowed to wear our clinic attire outside of the clinic. Our scrubs we were able to wear because we had a lab coat over top of it, but our lab coat always had to be removed whenever we were leaving clinic. And we were never, ever, ever allowed to wear any of that stuff home. We always had to have socks or stockings on whenever we were in clinic, and they had to be white. They couldn't have any patterns on them. They had to be purely white. And they can't just be short socks. They had to be mid-calf length socks or knee-length socks. So that way, whenever you were in clinic, your ankles never showed. Because apparently, showing off your ankle is very unprofessional. Now for our shoes also had to be all white, ideally all leather or some material that was very easy to clean up and disinfect. So that way, if again we got something on our shoes, we're able to quickly and easily disinfect them. I personally had white Crocs that I wore when I was in hygiene school. They weren't the actual like brand Crocs, but they were like a clog slash Croc. If I can find a picture of them, I will include it. But that's what I always wore when I was in clinic. But there were a lot of girls who wore pure white sneakers. We weren't allowed to have anything that was perforated, so we were able to have like the typical Crocs that you see, and we had to make sure that they were always closed-toed. There was nothing that could be an open toe, because God forbid we were to drop something on it or drop an instrument even, we don't want to be stabbing our toes. And then whenever we were not using them, they had to be stored in our lockers. We were able to just wear them around outside of clinic. Body perfumes, lotions, colognes, hairspray, anything that had a really strong scent was not allowed. We had to make sure that whenever we were working on patients, we didn't have any strong odor that may trigger any asthma or any allergies within anyone in the clinic. So I personally just never wore anything besides deodorant, obviously, because I didn't want to get in trouble for trying to smell good. You can't be eating or drinking in the clinic. That is obviously a very sanitary area, but you also are not allowed to chew gum while you're in the clinic setting. If anyone smoked, which I think there was only a few people in my class personally who smoked, you are not allowed to come into the clinic smelling like smoke. For your hair was always supposed to be neat, clean, and styled. If you have long hair like I obviously do, it always had to be off of the collar of our lab coat. So we weren't able to just have it to the side like this because that would be touching the lab coat. We had to have it either in a high pony or in a high or messy bun. For fingernails, this is something that I've mentioned before, but fingernails always had to be very clean. We had to make sure that we didn't have any dirt or anything underneath our fingernails. They always had to look nice, and we had a fingertip rule where your nails could not be seen past your fingertips. So we'd always have a finger check where you put your hands up like this, and if they could see your fingernails past your fingers, your nails were too long. We weren't allowed to have them painted. We weren't allowed to have acrylic nails or any sort of fake nails on them. We weren't allowed to have stickers. It had to be just our basic normal nails. Makeup, you were allowed to wear makeup, but it had to be very conservative. You weren't allowed to have a lot of makeup on, and you had to make sure that it was applied before going into clinic because you don't want to be applying makeup in the same area that you're going to be working on a patient. Our hands always had to be really clean. We had to make sure that there wasn't any nicks, any scabs, any open wounds in our hands, and we had to do so many things with hand washing. We had hand washing competency on how to properly wash your hands. That was one of the requirements going into clinic. Jewelry was another big thing. We were not allowed to have any facial jewelry whatsoever. So like your eyebrows pierced, your nose was pierced, your lip was pierced, your tongue was pierced, none of that was allowed. You had to have it out at all times whenever we were in clinic. As for earrings, you were allowed to have one earring per ear. It could not be a dangly earring, and you were not allowed to wear gauges. So I personally have 3 holes on one side and 2 holes on the other, but I was only able to wear 1 earring per ear. So out of the 5 earrings that I typically would wear, I was only able to wear 2. Watches were allowed, but we had to make sure that they were always covered up whenever we wore our long sleeve shirts or with our lab coats. You were allowed to wear your wedding band, but only if it didn't have any diamonds in it. So for me personally, my wedding band and my engagement ring is soldered together, and there's diamonds all around both of them. So if I would have been married in hygiene school, I would have never been able to wear this. Necklaces, you were allowed to wear a necklace if it was something really small and dainty, and it had to be able to be tucked underneath your shirt. I personally never really wore any necklaces just for that reason. I didn't want to get in trouble for anything, so I try to keep everything to a minimum. So aside from all of the rules, which I feel like I could go on and on about for days, and I will make several videos talking about certain clinical rules and certain forms that we had to have for every single patient, but what I did personally was a 144 quarter credit hour program. So I of course had the clinical setting where I was working on patients and learning instrumentation and all of that, but I also still had the traditional school class setting that most students will go through. So on top of having to be a high school graduate or having your GED, you'd have certain requirements from high school as far as GPA goes to get into and be able to apply for the program. Upon doing that, you had your pre-admission tests, and of course you had to score a certain percentage to be able to pass those. We also had to have a pre-entrance physical and an eye exam just to make sure that we're healthy, everything's in working order, and obviously our eyes are in good shape because you really need your eyes to be able to do this job when you're working in a very small area on patients with very sharp instruments. And then of course we had to have proper documentation that we were up to date on our hepatitis B immunizations, and we were also good on our TB testing. We also had to go through like a background check, so we had to make sure that we weren't a felon or hadn't committed any type of felony, as that would disqualify us from the program. But we also had to have a clearance for Act 34 and an Act 151 for child abuse prior to being able to get into the program. And then depending on how many people apply for the program, you are ranked. So let's say there are 25 spots for the program and 100 people applied and they actually passed everything, well, only the top 25 grading wise would be accepted. The courses that I had to take were microbiology within the oral cavity, chemistry for the dental hygienist, tooth morphology, orofacial structures, dental hygiene preclinic 1, 2, and 3, dental radiology in lab 1 and 2, dental embryology and histology. We had perio 1 and 2. We had actual dental hygiene clinic 1 and 2. We had intro to dental materials and correct concepts of dental materials. We had oral pathology 1 and 2. We had dental hygiene clinic 3. We had local anesthesia for the dental hygienist with a lab course. We had dental hygiene clinic 4. We had intro to pharmacology and dental pharmacology with pain management, also that included a lab. We had perio 3 and perio 4, which was advanced periodontal therapy. There was dental nutrition and preventative oral hygiene concepts. There's clinic 5 and clinic 6. And then there was community dental health 1 and 2. Then there was dental hygiene clinic 7 and 8. And then we also had anatomy and physiology 1 and 2. And then for our gen ed courses, we had psychology, college communications, chemistry for the health sciences, human behaviors, and dynamic communications. And then we also had a career preparation course, which was professional development. So those are all the courses that I had to take for dental hygiene school to become a dental hygienist. I think that was 41 classes that I had to take, and 41 classes that I personally finished within 19 and a half months. So I hope that was a good insight in what to expect whenever you are going into and starting dental hygiene school. Like I said, I will be making more videos talking about each of these certain subjects and going way more in depth. If there's anything in particular that you personally would like to see, please let me know down in the comment section down below. If you are not already subscribed, please make sure that you hit that red subscribe button so that you don't miss out on any of my videos. And if you want to be notified every single time I post, make sure you hit that notification bell. If you enjoyed this video, please make sure you let me know by hitting the thumbs up button. Give this video a like. This very well may be the very last video that I ever make in our apartment, so please bear with us while we are moving into our first home. Thank you guys for watching and for all of your support. I so greatly appreciate it. I hope you all have a wonderful day, and I will see you guys in my next video. Bye guys.